मेरे सोशल मीडिया के दोस्तों, my friends are from social media. This is Mujahid Ghazi, and I am here today to talk about a very important issue which our community as a whole they face, and that issue is how to deal with the monster which is called cancer. This is October, and October is a month every year we recognize at the Cancer Awareness Month, especially for breast cancer. Let me tell you a story. It was 2014. I moved to Guyana in January, and in July, I came to Georgetown. I was living in Berbice on some outreach mission. And in July, I came to Georgetown to meet some people, and I was going back. And while I crossed the bridge, the Berbice Bridge, and it is very dark, 8 or 7:30 at night. I crossed the bridge, and I was at that Berbice Road where there are trees both sides, and then you pass those trees, and there is this like open area, and some flash of fast flashing light came towards me and hit the car on the right side. And I couldn't figure out what it could be, and I was scared. And I drove another 10-15 yards, and the car started getting a noise from the front wheel, and it was not moving. I get out and see that the fender was broken, and there was a leakage of some kind of liquid. At that point, I didn't know that it is my windshield fluid which is leaking. But I pulled the fender and put it in the back of the car, sit in the car, and I drove. Little that I know that I didn't hit a jaguar. A jaguar hit me, and it was like big jaguar. The Kaitier News had this picture, and on the, I think, front page, or probably on the front page. And I called them and I said, and they were looking for the person who killed the jaguar. And I called them and I said, you know what, I think I'm the one. And I told them I didn't kill the animal. I love animals, especially jaguar is an endangered species, but it came and hit my car somehow. Probably it thought that it is some animal coming towards, going the lights, and it jumped on it. So tell me, what are the odds that a jaguar could find a person who is born in Pakistan, lived in America, and came to Guyana to do some outreaches and to help some people who suffer from cancer? What are the odds? You see, if you take jaguar as an example, cancer is actually that jaguar. It hits you when you least expect it. It hits you when you are not at all aware of what's going to happen. It don't see race. It don't see any caste or creed. It don't see any age. It hits you when you least expect it. In South America, there are like 1.3 million people die every year. It's not me, it's PAHU. It's calculation. It is a couple of years back that they printed this poster. Now it is a little more than what I'm telling you. 120,000 women die from cancers in the Americas, and 96,000 at that time. Now it's more than 100,000 women die every year of breast cancer. 36,000 die of cervical cancer. And what we have to do is we have to find a way to fight this monster. there are ways where you can take care of yourself and kill this monster. Mostly people, especially the women, they they are in denial, or they are not aware of what is going to happen if they ignore a small tiny lump in their breast, or they don't screen themselves. When they don't screen themselves, uh, the cancer becomes fatal. Screening starts from your own self. Screening starts when you have to do your own self examination every month. And every month you examine yourself, and you fix a date. Women who are having their periods regular, they can fix fifth or sixth day of their period every month and examine themselves. Okay, and examining yourself is actually is a very easy. Here are some pictures and demonstration how you can examine yourself. You lie down, right hand, left breast, left hand, right breast, and you go clockwise, and you apply pressure, not very hard, not very soft. And if you feel any lump or mass, you note down what location is it. For example, 2 o'clock, 3 o'clock, 1 o'clock. You write it down and take it to the medical professional or your doctor, who will then order other tests or examine. The doctor will examine you and do. So this is how you have to do. And mostly then you stand in front of the mirror and you see if there is any difference in both breasts, if there is any discharge from your nipple. So this is done yourself. But from 20 to 40 years, you can go to a clinical breast examination to a professional, a medical doctor or nurse. And from 40 years onwards, it is every year you have to go to a doctor. It is kind of screening, right? And the 40 years after your 40 years, you have to do mammogram. Mammogram is the gold test for breast lumps and breast masses. But if it is also supported by ultrasound, breast ultrasound, because many times, if the breast tissues are dense, it is difficult with mammogram even to find a small tiny mass, and ultrasound comes handy, and you can do ultrasound and get your breasts checked. So if we keep screening ourselves like the woman, and by the way, 1% men can also suffer from breast cancer. So when you talk about risk factor, woman is the top risk factor. Then you have if you have anybody in your family with breast cancer, your sisters or mother, you're more likely to get, or you're at high risk to get breast cancer. And if you have a few children, one child or no child, you are at high risk. This is the difference between cervical cancer and breast cancer. In cervical cancer, if you have more children, you are at risk, and in breast cancer, if you have less children, you are at risk. You are at risk if you are obese, and you're at risk if your diet if your diet contains a lot of those junk food and canned food and all those things. People don't understand. Uh, I'm coming from America, and in America, most of the people are going for natural food. Whole Food is a big food chain there. But when I came here, I was surprised to find that a lot of people in Guyana love canned food. They love to get those American and Venezuelan and Brazilian cans and eat out of them. Uh, Let me tell you, nothing is better than fresh food. And Guyana has abundance of fresh food, vegetables, fish. I I moved to Guyana for a special mission for some uh, special mission in my life, that I would screen people with cancer and try to help people who don't have resources for treatment for cancer. And we do it. We have a foundation, Cancer Care Americas, and I do help people once in a while, whenever somebody reaches me. But like regularly, we do outreaches, cervical cancer prevention outreaches in the regions by doing pap smears and breast ultrasounds and examinations with cooperation of other organizations. But what I'm trying to say to women out there is that if you can screen yourself regularly, if you screen yourself before anything happens to you, it saves your life. I tell my patients, people more oftenly, that when you feel the lump, it is already too late. Okay, screening is to prevent to yourself. Screening is to find it before it finds you. If it finds you, then we are late. Uh, we can talk about the treatment and what, but for diagnosis, how to diagnose breast cancer, I just said mammogram, ultrasound, clinical examination, self-examination. But the last thing to finally diagnose breast cancer is to do a core biopsy, core needle biopsy. And a lot of women I talk, when it comes to biopsy, they just get scared, and they don't want to do it. Some neighbor would tell them, some friend would tell them, don't do it. It's going to be bad, and the cancer is going to spread. All kind of myths are there, and even if we do the biopsy and we find a person with cancer, the person would not want to go for chemotherapy or for radiation, or if it is cervical cancer, or surgery, because they would say that chemotherapy is not good because your hair would fall, and a lot of side effects. But the normal cells, normal body tissues will be affected. Let me tell you, chemotherapy kills only those cells whose DNA is altered into cancer cell. It does not kill the healthy cells. It does not do anything to the healthy cells. Chemotherapy is a treatment, like any other treatment, like you get antibiotics and there are side effects. Chemotherapy has side effects, but as soon as the treatment is over, the side effects are gone. Lot of time people say they will get, I will get the bush medicine. I'm not against herbal supplements or bush supplements, but not on the cost of the researched medicines and researched treatments, where mankind has spent millions of dollars in research and come to a point where they know that which chemotherapy is good for which kind of cancer. And I had so many stories since I came to Guyana, how some woman would go for bush medicine and don't listen to me or convincing them or any other person. And sadly, we come to know that the cancer has spread. They come after 6 months or a year, and at that point, nothing can be done because cancer spreads. So I just want to request the my friends out there. Uh, this is going to be public broadcast, so women out there, even men who feel like their breast has some mass, or uh, they have to come to the doctor. They have to go to any medical professional who has uh, who has facility to diagnose or uh, these breast cancer or cervical cancer. Why I'm talking about cervical cancer? Because cervical cancer is very common. Uh, just a simple test, pap smear, or VIA, in the government hospitals, could tell us about the changes in the cells in the cervix, and they can be taken care of. I really want to request everybody who are watching this show to understand the importance. Um, I have so many slides here, but this is the biopsy slide. How you did it's a needle, okay, and it goes into the. If I do under ultrasound, and people do by palpation also. This needle goes into the tissue and gets a very thin, small, tiny sample, and which is put in the formalin and sent to the lab if somebody has a mass. This is what it is. I mean, early detection is the key. Early detection is the uh, early detection is uh, saves lives, because early detection. If we detect early, then you know what, this monster can be defeated. But what happens that we don't. Uh, we are in denial, and when we are in denial, we lose. Okay, so we have to be very uh, conscious about our health. We have to do our screening. And men, don't you run away from me. Prostate cancer is very common, and it kills a lot of men here. Okay, and prostate screening is also important. If you are 50 years or more, uh, uh, you have to do prostate screening. You have to go to your doctor, and your doctor has to do a digital rectal exam, or in my case, I use ultrasound to look at the prostate gland, if it is big, if it is suspicious, and along with that, a test called serum PSA. PSA is prostate specific antigen that would do screening. After screening, if we find any problem, there are doctors there, oncologists there, radiation oncologists there, who can help you out to get rid of the cancer, if not completely, but sometimes it gives remissions, like you're cancer free for so many years. The days are gone when cancer was taken as a death sentence. We have so many survivors, so many people out there who are who fight with this monster, and who win the war, and they are productive members of the community. Uh, one request for the family members and the people around a person who has cancer, that they have to be compassionate. Cancer is a taboo, right? But you can't just leave the person and not help them. There are people out there who might not afford treatment, people out there who might not afford the diagnostic procedures. There are people out there who probably can't afford chemotherapy. You as a community, as a society, whether if you're a relative of someone, or the corporate businesses out there, they have to come forward and help them. The walks and the talks, everything is necessary to create the awareness. But the most important thing to do is to help these people who suffer with cancer. I have seen a lady in Mabaruma. She was a pharmacy assistant, a pharmacy tech at the hospital there. And when I see her, her 9-year-old, actually not 9, it was 6, 7 years old son was on her side, and she was lying on the bed with cancer, had infiltrated into her spine, and just because that she could not afford to travel to Georgetown, and she could not afford to have a CT scan, and just because somebody put her on bush medicine treatment for a year, and we brought her here. We did I think CT scan, but it was too late. She died later on. A lot of women out there are struggling, and my request is, just because, not because it is October month, this struggle goes on around the year. My request is, feel the pain of that person who know that there are treatments, who know that there are chemotherapy and different tools to deal with the cancer, but because they don't have money, they can't have the treatment, and they die. I request you all to think about it. Just imagine if something happens to you, what's going to how you would react to it. So please help your community, help the people who suffer from cancer, help those people who are fighting with this monster as an organization, as an institute, and do the best. And with this message that we are going to join hands, and we are going to work together to deal with this problem as a community, as a country, as a nation. Thank you. And I'll see you in another talk on some other topic soon.